It was only a matter of time before it came down to something like this. And they're going to pay nurses one way or another. Because now parents are stepping in. Let's talk about it.
But you can live pretty well by yourself.
What's good, YouTube? It's your man CJ, aka the High Value Nurse, checking in once again, back with another video. And I have a story for you today. And this one reads, nurses for medically fragile kids are underpaid and hard to find. Parents want the state to step in. Now this comes out of Colorado. Ladies and gentlemen, I've been to Colorado. Colorado is a lovely state. I went there when I was truck driving, so it's a lovely state. It says Colorado's Medicaid reimbursement rates for private duty nurses who provide in-home care for children and adults are about $9 per hour, less than the national median. Wow. Listen, before we get into this, I want to encourage you all. If you all cannot make it as a nurse in whatever state you are in, you have to move. You have to go to where the money resides, okay? Some people say it's not that easy. Well, you need to make it easy enough to where you can get you and your family up out of a situation to where you can go make you some real paper. It says nurses willing to care for medically fragile children and adults, including patients who use feeding tubes, can't walk or speak, and rarely leave their homes, are hard to find in Colorado. But I thought this was about the love of it. I thought it was about the love, right? No. Nobody would do anything for free. I keep telling y'all that. Amid a statewide nursing shortage so dire that even state mental institutions are offering $14,000 sign-on bonuses. That's not enough. The lowest paid nursing positions are going unfilled. Duh. It says that means many parents who have relied on private duty nurses for in-home care for their children and adult children are getting no help. And that's unfortunate, but you're going to pay nurses or you're going to suffer. Colorado's Medicaid program reimburses the agencies that employ these in-home nurses at some of the lowest rates in the nation, according to the Home Care and Hospice Association of Colorado. While I'm doing that, let me look up the average rate of pay for nurses in Colorado. All my Colorado nurses, I need y'all to tap in real quick. According to Indeed, it says the average nurse salary for a registered nurse is $41.42. Let's see. Colorado LPN pay. It says $33.65 average salary. Okay, so according to ZipRecruiter.com, it says $28.51 per hour for average. So it don't seem that bad. But let's get back to the article. To the article. It says Colorado's Medicaid program reimburses the agencies that employ these in-home nurses at some of the lowest rates in the nation, according to Home Care and Hospice Association of Colorado. The rate for registered nurses in Colorado is $7.05 per hour, below the national median, while the rate for licensed practical nurses is $9.04 below the median, according to the association's analysis. This puts Colorado in the bottom third of states, and it's why parents of children with extreme health issues are asking lawmakers for a $15 million boost in state funding. The money would raise Medicaid rates that pay nurse salaries. Now you getting the parents involved now. It's not a game no more. The kids are sick, they need care. Y'all gonna pay these nurses one way or another. Or you're gonna suffer. You're going to suffer. Parents of a 7-year-old girl with a heart defect who uses a trach tube to breathe have lost 3 in-home nurses to better paying jobs. Listen, and I feel horrible for that young child that has to suffer due to people being cheap. I feel so sorry, but that goes to show you when the cards are stacked, It is about that PAPE at the end of the day. And again, I'm no way saying ha ha or anything like that. I think it's horrible that that little girl can't get the care that she deserves because people don't want to pay these nurses. But people have to eat. Nurses have to put food on their tables. They got their own families to feed. It is what it is. Leaving them on their own to resuscitate their daughter with a handheld oxygen bag after a seizure. One nurse commented as she left that she could make more money caring for inmates in a jail than kids in their homes. The girl's father told lawmakers during a budget hearing this month. A mother of an 11-year-old boy with a rare neurological disorder has had to do CPR on her own child. It says Galia, I'm not going to say her last name, wheeled the boy to the state capitol this month to ask for help. The pediatric home health nursing shortage was very, very alive before COVID and the pandemic, but now it's really bad. We are in a crisis. We haven't had a wage increase in more than 5 years. Wow. And Amy, I'm not going to say her name, a mother of a 13-year-old boy who is medically fragile and nonverbal, has been unable to hire a night nurse for 5 years. She works full-time as a city planner and then takes care of her son, who is fed through a tube in his stomach and has daily seizures in the night. She says, I am working 2 full-time jobs, 120 to 140 hours a week. She said, it's very difficult to be in that situation. So some of you people out there have absolutely no excuse, especially you dudes. It's women out here, single moms that's working 120 to 140 hours a week, then have to come home and take care of a sick child. You have no excuse at this point. The reimbursement rates are not adequate at all. Not adequate for home health care workers to make ends meet and attempt to live in the state of Colorado. There's an enormous amount of work that caregivers do. They're working alone. They're working with fragile patients. They are incredibly important to families that have medically fragile people in their lives. It says the families testified during the Joint Budget Committee's annual hearing, in which anyone in the public can offer lawmakers their thoughts on state spending priorities. The public hearing is a deviation from the hours and hours of testimony and legislative committee hears all year from state agencies making budget requests. The Home Care and Hospice Association, representing agencies around the state that hire private duty nurses and set their salaries based on the state's Medicaid reimbursement rate, wants Colorado to add an additional $15 million to the state budget for private duty nursing. That's on top of the $137 million proposed for the program next year. The requested boost, totaling $30 million with federal match, will be equivalent to about $20 per hour to a $20 per hour increase in the reimbursement rate for private duty nursing. It's a really tough budget, and the state is going to have to make some really tough decisions, said one of the parents. We think this should be a huge priority. It is $15 million, and we know that's a huge ask, but the benefits to the community are going to be so great. The association estimates that almost half of the cost will be offset by reducing the number of medically fragile people who are kept in hospitals, also at the expense of Medicaid, because they do not have someone to care for them at home. Ladies and gentlemen, this is not good. This is not good. Colorado got a lot of work to do. They got a lot of work to do. Says Governor Jared Polis' budget request for the Colorado Department of Health Care Policy and Financing, which includes the Medicaid division, called for a 1% increase for private duty nursing and other Medicaid providers, but citing healthcare worker shortage, the Joint Budget Committee in January gave preliminary approval to a 2.5 across the board increase for Medicaid providers instead. The Home Care Association wants a 38% to 52% increase above Colorado's current hourly rates. The Joint Budget Committee it says the Joint Budget Committee has months of work left before making its final budget recommendations for the next fiscal year, which begins July 1st. The 5-member committee has not yet made a decision on the request. Well, that just goes to show you. That goes to show you that it's about that paper. It's about that paper, and it always has been about that paper. It says other states have increased private duty nursing rates in recent years by 10 to 20%, while Colorado rates were raised 3% last year. Some states, including Texas, Arizona, have used federal coronavirus aid to raise pay for in-home nurses. Colorado's Medicaid reimbursement rates for private duty nursing are $52.53 per hour for RNs and $39.69 per hour for LPNs. The rate paid to agencies must also cover administrative costs and recruiting costs, cutting into nurses' hourly wage. Pay for private duty nursing varies, but job postings in Colorado also offer about $30 per hour, and families say their nurses are paid as low as $25. Colorado's minimum wage is $14.12 per hour. That's unfortunate. It says statewide, 932 people received private duty nursing services last year. Well, ladies and gentlemen, I think it's an unfortunate situation, but it looks like Colorado is going to have to make some changes, because if they don't, you're going to see a backlash from the parents. Just when you don't think it's about the money, they always show you that it is about the money. So let me know what you think. Link to the article will be in the description. Make sure you hit that like button, subscribe button, notification bell so you don't miss none of the content. Until next time, you don't do nothing else. Get paid. Young nurse, get paid. Peace.